Hello. Stroke is now one of the leading causes of disability among working adults in India in this decade. The most painful part is that a large part of these strokes could have been prevented with simple daily actions. There is something important that many people do not notice. Doctors who work with the brain every day and see stroke patients all the time rarely suffer a stroke themselves. This is not only luck. They protect their own brain with small habits that they repeat without fail. Today I want to share with you 7 simple morning habits that take about 2 minutes each and can become a powerful shield against stroke for office workers in India. I am Doctor Heartwise, cardiologist. I will not only list these habits, I will explain why they protect your brain and how you can start them tomorrow morning. Pay close attention and stay with me until the end, because habit number 1 is based on something very common in daily life that many neurologists quietly practice to protect their own brain, but is rarely discussed outside medical meetings. Before we begin, if you want to defend your brain and stay independent for as long as possible, press like on this video and subscribe to the channel. Share it with colleagues and family who spend long hours at a desk. In the comments you can write whether anyone in your office or family has had a stroke and which city in India you are watching from. Now let us begin with habit number 7 and move down to the most surprising one.
Before we go into the habits, let me tell you a short story. Raghav is 48 years old and works as a manager in a large office in Bengaluru. He sits for long hours in meetings and on calls. His checkups are irregular, but he feels mostly fine. One Monday morning during a team meeting, he suddenly finds that his right hand drops the pen. His speech becomes unclear and one side of his face changes. His colleagues are shocked. They call an ambulance, but the nearest hospital is not prepared with a stroke team. There are delays in scanning and treatment. The stroke leaves him with weakness on one side and difficulty speaking. He cannot return to his previous role. Later, his wife is told that his blood pressure and sugar had been high for years and that timing is everything in stroke. Part of this tragedy could have been reduced with prevention and with simple habits that protect blood vessels every single morning. No family should have to hear the words "this could have been prevented." So let us go directly to what you can do.
Habit number 7 is to hydrate your blood the moment you wake up. It sounds basic, but it is powerful.
During the night, your body loses water through breathing and sweating. You wake up more dehydrated than you feel. When there is less water in your system, your blood becomes thicker and more viscous. Thicker blood flows more slowly and can increase the strain on the heart and the arteries that supply the brain. In the early morning, many people in India drink strong tea or coffee as their first drink. Caffeine can mildly constrict vessels and for some people can raise blood pressure for a short time. If you start the day with thick blood and extra pressure, you may be adding to the risk that a small clot causes trouble. A simple habit can change this. Before you touch your phone, before you drink tea or coffee, drink a full glass of clean water. Leave a glass or bottle near your bed each night so that you do not forget. 7 to 10 ounces is enough to begin. If your doctor has not restricted your fluids, you can drink a second glass slowly. Think of this as washing the pipes inside your body. You make blood easier to move, reduce the early morning strain on vessels and support your kidneys and heart. Do not wait until you feel very thirsty. Thirst is already a late signal from your body.
Habit number 6 is to wake up your circulation with gentle movement.
After many hours of sleep, your circulation slows and your muscles and joints may feel stiff. Jumping straight from bed into a rush, checking messages, running to get ready and hurrying to the office can shock a system that is still waking up. Light movement in the first minutes after waking works like a warm-up for your circulation. It helps blood flow more smoothly to your brain and limbs and prepares your vessels for the stresses of the day. You do not need to do intense exercise at this time. 2 to 10 minutes is enough. You can stretch in bed, gently extend your arms and legs, rotate your ankles and wrists and slowly turn your neck side to side without forcing it. Then stand up and do a few simple stretches, reach upward, bend gently toward your toes as far as is comfortable and walk slowly around your room or hallway. Regular physical activity is known to lower blood pressure and improve vessel health. By adding gentle movement in the morning, you begin the day with better blood flow. If you already have joint pain or heart disease, ask your doctor which light movements are safe for you.
As you listen, think about what kind of gentle movement you can start tomorrow morning. In the comments, you can write which idea you plan to try so that others can learn from you. Habit number 5 is to check your blood pressure in the morning if you are at risk.
Stroke often peaks in the first hours of the day between 6 and 10 in the morning. One reason is the natural rise in hormones like cortisol that prepare the body to wake up. This rise can push blood pressure higher. High blood pressure is the number one risk factor for stroke worldwide and often causes no symptoms for years. Many office workers in Indian cities live with high stress, salty food, lack of sleep, and limited movement. Their blood pressure quietly climbs while they feel normal. The only way to know is to measure it regularly. If you are over 35 or have a history of high blood pressure, diabetes, kidney disease, or strong family history, invest in a validated digital arm blood pressure monitor. Keep it where you can see it. On selected mornings, measure your pressure soon after waking, after using the bathroom, before tea, coffee, or tablets. Sit quietly for 5 minutes, keep your back supported, feet flat on the floor and your arm resting at heart level. Take 2 readings about 1 minute apart and write them down with date and time. Do this on a few days each week and bring the record to your doctor. They can see patterns that a single clinic reading cannot show. If repeated readings are often above 130/80, that is a warning sign. If they are above 140/90, that meets common definitions of hypertension. Your doctor can guide you on the next steps. Ignoring silent high blood pressure allows it to slowly damage the arteries that feed your brain.
If you have a monitor at home, decide which days you will start using it regularly and write that plan down after this video. Habit number 4 is to choose an anti-inflammatory Indian breakfast instead of a sugar and oil bomb.
The first meal of your day sets the tone for your blood vessels. A breakfast rich in refined carbohydrates, sugar, salt, and unhealthy fat sends your blood sugar and insulin up sharply. It can also raise blood pressure and inflammation, which over time injure arteries. Typical rushed breakfasts like multiple cups of sweet strong chai with biscuits, white bread with butter or margarine, deep fried snacks, or leftover heavy curries may satisfy taste but can harm vessels if eaten regularly. A smarter breakfast focuses on fiber, good quality protein, and healthier fats. For many people, options can include oats cooked with water or milk topped with a small handful of nuts and a piece of fruit. Poha with vegetables and minimal oil. Idli with sambar and extra vegetables. Whole grain bread rather than white refined bread. Eggs with a small amount of healthy oil instead of large portions of deep fried items. Try to reduce added sugar in tea and coffee step by step. Read labels on packaged cereals, flavored yogurts, and juices. Many contain more sugar and salt than you expect. Your goal is not perfection. It is to shift the average breakfast away from high sugar and high fat toward more natural fiber-rich foods. When your morning meal keeps your sugar more stable and reduces inflammation, you protect the delicate inner lining of your arteries. That lining is where plaques begin. Healthier breakfast habits over years can lower your chance of clogging the vessels that supply your brain.
Habit number 3 is to give your nervous system a 2-minute calm start.
Modern office life in India is full of deadlines, traffic, and constant messages. Many people open their eyes in the morning and immediately check emails, work chats, and news. The mind enters a stress state even before the body has fully woken up. Chronic stress releases chemicals such as cortisol and adrenaline in high amounts. These raise blood pressure, disturb blood sugar, and promote inflammation in the vessel wall. Over time, this environment increases stroke risk. You do not need long meditation to start changing this. Before you pick up your phone, sit on the edge of your bed or on a chair with your feet on the floor. Close your eyes gently. Place a hand on your belly. Breathe in slowly through your nose and feel your abdomen rise. Breathe out even more slowly through your mouth and feel the abdomen fall. For 2 minutes, simply follow the movement of your breath. When thoughts about work come, notice them and then gently bring your attention back to the air moving in and out. You are sending a signal to your nervous system that the day does not begin in full alarm mode. 2 quiet minutes each morning will not remove all stress from your life, but they can lower the baseline strain on your arteries. If you already use a morning prayer or reflection time, you can combine this breathing with it. Let this become your daily pause before the noise of the day starts.
Habit number 2 is to plan micro movements to escape the danger of long sitting.
Many office workers in India spend 8 to 10 hours or more sitting at desks, in cars, and on sofas. Even those who exercise for 1 hour may still sit for most of the remaining day. Long stretches of sitting slow circulation, especially in the legs. Blood can pool in the inner lining of veins can become irritated, which increases the risk of clots that may travel. Research has linked long sitting time with higher risk of cardiovascular disease including stroke. The good news is that breaking up sitting time with small bouts of movement can improve circulation and lower risk. This habit is not about doing a full workout in the morning. It is about planning your movement for the rest of the day while your mind is still fresh. In the morning, take 1 or 2 minutes to look at your schedule. Ask yourself where you will likely sit for long periods, such as long meetings, long calls, or computer work. Then plan small actions to interrupt that sitting. Set gentle alarms on your phone or watch to remind you to stand up at least once every hour. When the alarm rings, stand, walk to get water, walk to a window, and stretch your legs for 2 or 3 minutes. If your building has stairs and your doctor allows, use stairs for a short climb once or twice during the day. When you take phone calls, stand up or walk slowly if space allows. Planning these micro movements in the morning makes it more likely that you will actually do them. Over time, these small interruptions of sitting help your vessels and metabolism. They work together with your main exercise routine to protect your brain and heart.
If you know that you sit for many hours each day, choose now how often you will stand and move. Write that plan after this video and keep it where you can see it. Now we reach habit number 1. It protects your brain by caring for your gums. Many people do not connect oral health with stroke at all, but the link is real.
The tissues of your gums are full of tiny blood vessels. When gums are healthy, they form a firm seal around each tooth. When they are inflamed, a condition often called gum disease, they break down and bleed easily. Bacteria and inflammatory substances from the mouth can then enter the bloodstream more easily and travel through the body. Chronic gum inflammation has been linked in several large studies to higher risk of stroke. The constant low-grade inflammation appears to make it easier for fatty deposits to build up in arteries and for clots to form. An unhealthy mouth can quietly increase the burden on your blood vessels. The simple tool that many people skip is daily cleaning between the teeth. Brushing alone often cannot remove food and plaque from the tight spaces where the tooth meets the gum. That is where inflammation often starts. Use dental floss or another device recommended by your dentist to clean gently between your teeth at least once a day. Morning or night is fine. Choose a time that you can repeat without fail. Slide the floss between the teeth and curve it around each side of the tooth, moving gently under the gum line without rough forcing. At first, your gums may bleed. This is usually a sign that they are already inflamed and need more care, not less. With regular cleaning, the bleeding often reduces over days to weeks as the tissue becomes healthier. Daily care for your gums will not replace other stroke prevention steps, but it can remove one hidden source of inflammation that many people ignore. Think of it as polishing the inside of your blood vessels from the mouth outward.
These were 7 morning habits that can strengthen your defense against stroke if you are an office worker in India. Each habit takes only a few minutes, but together they can have a large impact on the health of your arteries over years. You do not need to start all 7 at once. Begin with 1 or 2 that feel easiest and add the others over time. The goal is not perfection. The goal is to move your daily routine in a safer direction. If these ideas helped you or opened your eyes to something new, press like on this video. Share it with colleagues, parents, and friends who spend long hours sitting or who have high-stress work. In the comments, tell us which habit you will start this week and which other topics about stroke or brain protection you want to learn about in future videos. Subscribe to this channel and turn on notifications so that you do not miss the next lessons from Dr. Heartwise on stroke prevention, heart attacks, stress, brain health, and heart health. Prevention of stroke is often much simpler than people imagine. The time to protect your brain is now while you still feel well, not after an emergency. Start with one small habit tomorrow morning and keep building from there.